After surgery, the therapy team will work with you to make sure you're comfortable using the cold therapy device, sling, and getting clothes on and off. For the cold therapy device, you'll first fill the reservoir with distilled water. Peel back the rubber fill cap and slowly pour the water so that it fills between the min and max levels to maintain optimal performance. You'll then attach the tubing to the Thermozone unit and the pad. Remove the white caps and attach to the connector ports and then turn clockwise. Connect the power source and plug into an outlet. Press the on button. The digital display will now say on. Water poured in previously has now been pumped into the relief pad. Slowly pour more distilled water into the reservoir while the unit is on, and be sure the water level is between min and max. Select Cool. You may adjust the temperature by pushing the plus or minus keys. If you've selected the timer mode, you can push Cool to see how much time is remaining. Apply the relief pad. The straps should be snug enough to hold the pad in place, but loose enough so there's no discomfort. Sit back and relax. While at the medical center, you will learn exercises for your hand and elbow to do 4 to 5 times a day. The first exercise is going to use your other arm to bend and straighten your elbow. You can perform this a total of 10 times. The second exercise will involve moving your hand and wrist. This should also be performed at least 10 times. We encourage you to use your operative hand for basic activities after surgery that don't involve lifting, pulling, or pushing. If you have an anatomic total shoulder replacement, the therapist will show you 2 additional exercises that we want you to do 5 to 6 times per day. The first exercise is going to use your other arm to raise your operative arm in the forward direction. The therapist will show you how to use your other arm to raise the operative arm in a safe way that won't hurt your surgery. The second exercise also uses your non-operative arm to move your arm with the new shoulder replacement in a position we call external rotation. These 2 exercises will keep your shoulder joint loose and prevent stiffness while we wait for the initial healing phase to be completed. The use of outpatient therapy will be discussed at your first post-operative visit.